Two patients can walk into a psychiatric ward, both hearing voices, both feeling paranoid. At first glance, they look the same, but they may have completely different conditions. One may have schizophrenia and the other may have drug-induced psychosis. As healthcare professionals, the key question is this a chronic illness or something that can reverse? Schizophrenia develops gradually and often lasts for a long time, sometimes for life. Drug-induced psychosis, however, is usually temporary and may improve once the substance is removed. Schizophrenia affects about 1% of people worldwide and often starts early, especially in young adults. Early onset is associated with worse outcomes and long-term disability. It can be caused by genetics, brain chemical imbalance, environmental stress, and even cannabis use. Research shows that individuals with a family history are at significantly higher risk, and substance use can act as a trigger. In the brain, dopamine imbalance plays a key role. Too much activity in the mesolimbic pathway leads to positive symptoms, while reduced activity in the mesocortical pathway leads to negative and cognitive symptoms. Symptoms include hallucinations, delusions, disorganized thinking, and agitation. But deeper symptoms like motivation, social withdrawal, reduced emotional expression, and cognitive impairment affect long-term outcomes and daily functioning. Substances like cannabis and stimulants can overstimulate dopamine pathways, triggering psychosis. Making the diagnosis takes time. We look at how long the symptoms last, the patient's history and functional decline, often over at least 6 months. There is no single test for schizophrenia, so we rule out drug use, infections, brain conditions, and other medical causes using blood tests, toxicology screening, and imaging when necessary. Both conditions may require medications to control symptoms at first. Some medications work strongly but may cause movement side effects like tremors and rigidity, while newer ones are safer for movement but may cause weight gain, diabetes, and metabolic complications. In resistant cases, special medications like clozapine are used, but they require strict blood monitoring due to serious risks. But in schizophrenia, treatment is often long-term, sometimes lifelong, while in drug-induced psychosis, it may only be needed for a shorter time. If the substance is stopped, many patients improve significantly, but continued use can lead to repeated episodes and permanent illness. In real clinical settings, patients may be severely ill, aggressive, non-compliant, or unable to care for themselves. As pharmacists, we play a critical role. We ensure the right medication, correct dose, and safe use. We monitor for side effects like movement disorders, sedation, and weight gain. We prevent harmful drug interactions. And most importantly, we counsel patients to stay on treatment. Care involves psychiatrists, nurses, pharmacists, and psychologists working together to stabilize and rehabilitate the patient. Challenges like stigma, poor adherence, and limited resources often delay treatment and worsen outcomes. Recovery depends on medication adherence, avoiding substances, especially cannabis, and regular follow-up. The temporary psychosis can become permanent if ignored. Schizophrenia is chronic, but manageable. Drug-induced psychosis may be reversible, but dangerous if ignored. Knowing the difference can save a life.